Abiraterone does combine relatively easily with other agents such as radium or enzalutamide and other treatments. There has been a study of abiraterone combined with Sipuleucel-T, the immunotherapy. So it's a fairly good combination partner, and it remains to be seen whether that would become a standard of care that we would treat patients with. There are a few questions that remain with respect to abiraterone. I think certainly continuing to push it into earlier disease states, as the IMAGINE study has attempted to do, is an important consideration. I think that from a research perspective, there's also room for us to study things like individual pharmacokinetics and how the drug is metabolized differently in different individuals, and how we might be able to leverage that or study that or respond to those variations in terms of making the drug more effective in different patient populations. Also, there is a lot of really interesting data now on the use of abiraterone in the pre-prostatectomy patient. So these are patients who are curable with surgery but have a high risk of recurrence. And there has been some really interesting data coming out of a couple of centers now showing that when abiraterone is given before surgery, it's not an uncommon occurrence that there is no tumor detectable when the prostate is removed. That occurs, depending on how you define it, in upwards of about 25% of patients. So that kind of approach is moving forward and is something that I think may promise to do a lot of good for patients who are curable but high risk for recurrence. And then finally, as you mentioned, combinations are of course an area that are being studied, and we'll expect to see more data coming out on combinations, both at the phase 1 and 2 level, but also there's a couple phase 3 studies out there that are accruing patients, and probably it'll be a couple of years before we have those final data.